Type 2 Diabetes Mellitus, Medications that Promote Weight Loss, Part 2. Copyright Endodiabetes Limited 2020. Disclaimer. This video is for information purposes only. It is aimed at the general public and health professionals. Do not start the medications of your own accord or stop the treatment prescribed by a health professional before discussing it and finding alternatives. This podcast discusses trial data. In some countries, some of the combinations of treatment discussed here may or may not be licensed. The license and implications of unlicensed therapies should be discussed before starting treatments. In the first part of this podcast, we discussed that metformin, GLP-1 analogues, SGLT2 inhibitors can all help with weight loss in patients with type 2 diabetes. We will now go through data that look into the impact of combining these medicines on weight loss and diabetes control. The principal side effects of the classes of drugs discussed in this podcast have been addressed in part 1 of the podcast. We will discuss the Duration 8 trial, Bydureon and dapagliflozin, an SGLT2 inhibitor. The Sustain 9 trial, Semaglutide and an SGLT2 inhibitor. And the Award 10 trial, Dulaglutide and an SGLT2 inhibitor. The Duration 8 study. It compared 3 possible treatments in patients inadequately controlled on metformin. Group 1 was given a long-acting preparation of exenatide Bydureon 2 mg once weekly. Group 2 was given dapagliflozin 10 mg daily, and Group 3 was given a combination of the two, so Bydureon and dapagliflozin. This was a blind study. Groups 1 and 2 were given adequate placebo. So during Duration 8, 695 patients were enlisted, and 523 of those, i.e. 75.3%, completed 52 weeks of treatment. The results were that HbA1c improved by minus 1.4% on Bydureon, minus 1.2% on dapagliflozin, and minus 1.75 on the combination of these two medications. So as regards weight loss, kilograms are given in the green columns and their equivalent in pounds is given in the blue columns for convenience. In brief, the weight loss was 1.5 kilograms in the Bydureon group, 2.3 in the dapagliflozin group, and finally 3.3 kilograms in the combination group. These results were achieved by the 28th week of the trial and persisted until the end of the study at 52 weeks. So let us look at the portion of patients achieving a 5% weight loss. In the Bydureon-only group, 14% of patients achieved a 5% weight loss. 21.3% and 31% achieved this amount of weight loss in the dapagliflozin and the combination groups respectively. The Sustain 9 trial. Semaglutide plus minus SGLT2. Semaglutide 1 mg weekly or a placebo were added to treatment of SGLT2 inhibitors where patients did not have optimal diabetic control. The study was 30 weeks long. There were 150 participants in the semaglutide group, 128 of whom completed treatment. There were 151 participants in the placebo group, 139 of whom completed treatment. Let us have a look at the other medications also taken by participants throughout the study which are used for the treatment of type 2 diabetes mellitus. 71.5% of patients were taking metformin, and 12.9% of patients were taking sulfonylurea. So the results of Sustain 9. The addition of semaglutide resulted in an improvement of both HbA1c and weight. HbA1c improved by 1.5%, and the weight loss was 4.7 kilograms. Once again, the weight loss in pounds has been given separately for convenience. The Award 10 trial. The Award 10 trial examined various doses of dulaglutide added to the treatment with SGLT2 inhibitors. The study population was 424 patients on an SGLT2 inhibitor plus minus metformin. They were randomly assigned to dulaglutide 1.5 mg weekly, 142 people, dulaglutide 0.75 mg once weekly, 142 people, or a placebo, 140 people. The study duration was 24 weeks. The results of Award 10. HbA1c was significantly better in patients given dulaglutide, and it was dose dependent. Weight loss is once again given in both kilograms and pounds. Weight loss was 3.1 kilograms in the high dose dulaglutide group, 2.6 in the low dose group, and finally 2.1 kilograms in the placebo group. So instead of a conclusion, the trial data indicate that the combination of GLP-1 analogues and SGLT2 inhibitors improves both glycemic control and weight in patients with type 2 diabetes mellitus. While the combination is tolerated well, a number of patients were not able to tolerate it or complete trials for other reasons, and some needed escalation of treatment. It is of note that the trials discussed have looked into weight loss, HbA1c, and other relevant parameters. The studies did not examine cardiovascular outcomes. The data presented in this podcast cannot be used to draw conclusions about the comparative efficacy of these medications. The studies discussed in the podcast were of short-term duration, 24 to 52 weeks. The long-term data and cardiovascular outcomes for these drug combinations are still needed. In the end, please be reminded once again that some, but not all combinations of GLP-1 analogues and SGLT2 inhibitors are licensed in some countries. The licensing varies worldwide and is not necessarily updated or driven by the data or evidence available. Copyright Endo Diabetes Limited, 2020.